running at my car.
18-year-old male hit by car. EMS has been called.
Is the scene safe?
Yes, the scene is safe.
How many patients are there?
There is one patient.
What is the mechanism of injury?
The mechanism of injury is the patient got hit by a car.
Do we need any additional resources?
No.
What is our general impression?
18-year-old male lying supine with obvious head trauma and possible chest and lower extremity injury.
What is our BSI and PPE?
Just gloves.
I am now assuming C-spine. Sir, are you awake?
Patient is unresponsive to verbal stimulus.
I'm now trying a painful stimulus.
The patient is unresponsive.
I am now checking the airway with a modified jaw thrust.
The airway is clear.
Does the patient have a carotid and radial pulse?
There is no radial pulse and the carotid pulse is rapid.
What is the skin condition and capillary refill time?
Patient is cool, pale, and diaphoretic with capillary refill time of 4 seconds.
Any major bleeding?
There are no signs of major bleeding.
This is a load and go. There is a small laceration on the right forehead, but there are no signs of deformities in the head. The patient's pupils are fixed and dilated. The patient has jugular vein distension and tracheal deviation to the right side. Are there any deformities in the neck?
There are no deformities.
The patient is presenting signs of subcutaneous emphysema and asymmetrical chest wall movement. His abdomen is also rigid. Are there any? The pelvis feels stable. Now examining his extremities. 1, 2, 3, 4, 5. There is no pulse in the right leg, and the right leg is showing signs of a femur fracture with major bruising. We are now examining the upper extremities. 1, 2, 3, 4, 5. There is no trauma to his arms, and he does not have a radial pulse. I'm applying the cervical collar. We are now going to log roll the patient. There is no visible trauma to his posterior side. We are now transporting the patient. The blood pressure is 86/72. His heart rate is 40 beats per minute. The breath sounds in the left lung are diminished, and the respiratory rate is regularly irregular, showing a pattern of Shane-Stokes. We are now treating him for shock. I'm applying a blanket to keep him warm. The blood pressure is 88/72. The pupils are still fixed and dilated. The carotid pulse is 44 beats per minute. And the lung sounds are still diminished on the left side, but they are good on the right side. There are no deformities in the scalp or head, and the laceration on the forehead has not worsened. The patient still has a very rapid carotid pulse and still no radial pulse, and he is being ventilated with high flow oxygen. There are no deformities in the neck and still tracheal deviation to the right. There is subcutaneous emphysema in both sides of the chest and major bruising to the left side. The abdomen is still rigid, showing signs of internal bleeding. The pelvis is still stable. Now I'm checking the lower extremities in 5 points. 1, 2, 3, 4, 5. There's a pulse in the left leg, left dorsalis pedis. 1, 2, 3, 4, 5. And there is no pulse in the right dorsalis pedis. And I am now splinting the right fracture. Okay, now I'm examining the upper extremities. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. They show no signs of trauma.